I also directly influence policy through my professional career because I serve as a public official, and I belong to various associations, including CHEAC, which is essentially the public health association that influences state and federal policy. I actually serve on the executive committee of CHEAC as the small county chair. And then there's the California Welfare Directors Association, and I sit on the board of directors for that association that influences policy related to social services and particularly child welfare. And I also serve on the California Mental Health Directors Association and on their executive committee, again as a small county chair, and I'm directly involved with talking to top state officials about how they implement mental health and drug and alcohol policies, as well as health system policy too. I also serve as the treasurer for the California Mental Health Services Authority, which is a joint powers authority that is responsible for the implementation of several of the Mental Health Service Act programs. And as treasurer, I have responsibility for $160 million in Mental Health Services Act funding. I also serve on the board of the California Institute of Mental Health, which is an advocacy and, more importantly, a research and training organization supporting the mental health industry in the state of California. And then I also serve on the board of CalSWEC and as its research and development chair. And CalSWEC is, while intimately involved with all aspects of social work through its office at UC Berkeley, it particularly has an influence on child welfare, social worker training and research and reformation. And I'm happy to serve on those boards because they allow me to directly influence policy, and through my service on all of those fronts, I'm able to interact with various state boards and commissions, as well as members of the legislature and state officials on a regular basis. And I'm able to communicate to them what our issues are and what some of the potential unintended consequences of policy that they're currently developing can have. You know, I may testify at a hearing in front of the Assembly or the State Senate in order to provide direct testimony on either the need for or the potential impact of a policy in rural California. And that's a very important role to have. And I look forward to having more people who not only understand that, but understand it to the extent that they can directly participate and make a difference for the people in their community that they both work for and for which they serve.
Boy, you know, if you are interested in a certain policy area, you can really move mountains if you're willing to devote the time and you have the interest and you are willing to be a leader and to be thoughtful about what it is that you see that needs to be changed. I think that you know, it takes time, but if you're willing to devote some time and energy to something that is meaningful to you, you can make a tremendous difference in public policy.
Perfect.
I've been involved in, you know, state and national arenas, and it gets frustrating at times, but I have seen major changes happen if you do it in a thoughtful, collaborative, and meaningful way.
Right. And sometimes persistent.
And persistence.
Okay.
Persistence is key. One of my favorite sayings is, well, this is, you know, not as relevant to this, but one of my favorite sayings is, all that is necessary for evil to prevail is for good men to do nothing. And I think that, you know, if you're not willing to get involved, then, you know, bad things are going to happen.
Struggled with that to some extent, that question of clinical practice versus public policy. To some extent, as a student, I have an MSW also, but also in looking at some of my peers who I felt didn't care enough about public policy when they ought to have, because I feel that it's the requirements of the programs that you will be delivering. It's the resources and whether the dollars are even there to provide services to people who are vulnerable in our society, who you probably went to graduate school to try to be a change maker and help them have a better life. So, I felt that for me, public policy was a good way for me to be a social change agent, because I had actually a professor who talked about public policy importance in our social welfare program, and he used an analogy of a conveyor belt, and that there are some individuals who really have a commitment to wanting to be that one person connecting with an individual or child or family and be responsible really for helping them at an individual basis. And if you sort of saw the social problems as a conveyor belt, they're the ones at the end of the conveyor belt sort of catching all of the people who sort of fall through the cracks and need public servants really to be there to provide supports for them. And then there are others who want to go in there and tinker with the machine and maybe prevent those people from winding up on the conveyor belt. So we really need both people. No matter what the resources we might want to provide or the wonderful laws we might create, there's still going to be people for whom their family upbringing or poverty or other things happen that they do need social supports, and they need professionals who are trained to help them at an individual level. But we also need people who care about the structure of our government, the kinds of policies our society sets up that might prevent people from having those problems in the first place, and also be there to provide the resources that those folks at the end of the conveyor belt will need to actually help people. I think it's frustrating and somewhat disappointing when you leave graduate school and go into a public policy job to sort of see, first of all, how slow social change really happens, and what you're really up against politically, not just financially. Whether if you thought that the lack of funding might be the reason that we had a problem, or a program that wasn't adequately meeting people's needs was funding, even if it's just a matter of the laws and how they're written. It's amazing how many baby steps it takes to really make a change, and the kinds of biases that you'll be up against in terms of people who don't have the same perspective on the role of government, the role of social services in helping people's lives. There are many who are in elected positions who feel that it's individual responsibility to pick yourselves up by your bootstraps, and I did it, my family did it against odds, and government, that's not the job of government. So it can be frustrating, but you have to sort of look at the small wins and see that you're making progress.
A public policy class, and one of the things we're going to do is we're going to look at the systems that involve mental health and the political frameworks in which they operate. And the reason for that is so that we understand the way policy affects the arena in which we work, as well as its role in the larger universe that controls it. And why that's important, so you know the correct points of entry in which to influence policy and be able to make a difference in its outcome and ultimately its impact on your life and the life of the people that you serve. And so we'll do that by looking at a real basic systems model for mental health, so to be able to recognize it from a systems perspective. And then we'll look at the larger political model in which that system operates and the various components of the political model that influence the system in which we work. And then once we understand that all-encompassing model with the mental health system and the political framework, and then we'll talk about how to find points of entry to influence those models in order to be able to influence the policy that comes out of each of those systems and influence and impacts one another. And you'll be able to do that through coursework and through the various readings and the lectures. But we'll also talk about some very specific real-time events that are affecting those models right now and changing the way that we work today, and what the most common emerging issues are that are going to be doing the exact same thing. So not only will we learn about policy and its implementation and development, but we'll also learn about it in real time, and we'll apply some real-time examples to that. And then that's even further carried out in this class, because each of you will have to write a policy analysis paper, and we're going to do it in various components, but you'll pick an issue that you want to study and basically look at how was the policy around that issue developed, and where did it develop, why did it develop, and what were the various factions or special interests that were involved either in support or in opposition of the development of that policy. And then to the extent that we can, how well was that policy implemented? In other words, did it actually create the impact that it was originally intended to create? And hopefully this course will give you the tools to, first of all, comprehend that entire system, and then the tools to figure out where you can enter and influence the process of making policy in the public system in our country today. And I hope you learn a great deal from that. Thanks.